Okay, good evening, folks. This evening's topic B is managing aggression in dementia. So here we go with tonight's discussion B, managing aggression in dementia. Aggression is one of the most challenging symptoms families and caregivers face. And the MSN article you're reading offers a solid foundation for understanding both why it happens and how to respond in ways that protect dignity, safety, and emotional well-being. Here's a deeper, more textured explanation of those strategies grounded in the article's content and enriched with practical info. Okay. Why aggression happens. Agitation isn't misbehavior, it's a stress signal from a brain that is losing the ability to filter stimuli, regulate emotions, and communicate needs. The article highlights two major forces at play: neurobiological changes, uh, degenerative changes such as cerebral atrophy, reduce the brain's capacity to manage impulses and emotional responses. As dementia progresses, the threshold for frustration becomes lower, so even the small even even small disruptions can feel overwhelming. Okay. External and internal triggers. The article lists a range of everyday triggers that can escalate aggression: caregiver pressure, being rushed to bathe, dress, or eat, medication side effects or interactions, constipation or pain, sundowning in late afternoon or evening, loneliness or loss of independence, overstimulation from noise, crowds, or clutter, sudden changes in routine or environment, poor sleep. Understanding these triggers allows caregivers to intervene early before agitation becomes aggression. First line approaches, non-drug strategies. The article emphasizes that non-pharmacological approaches should always come first. These strategies are powerful because they address the root causes of distress. Maintain predictable maintain predictable routines, familiar rhythms, reduce anxiety, and help the person feel anchored. Keep daily activities, meals, bathing, bedtime at consistent times. Identify and remove triggers. Reduce background noise, TV, multiple conversations. Limit the number of people in the room. Avoid rushing. Slow, steady pacing prevents overwhelm for folks. If a task is too consistently upsetting, e.g. showers, modify it. Try sponge baths, warm towels, or different timing. Address physical needs. Check for pain, constipation, hunger, thirst, or discomfort. Small discomforts can feel enormous when communication is impaired. Use calming techniques. Offer soothing music, a favorite object, or a simple activity like folding towels. Gentle touch, a calming voice, and stepping into their emotional reality can diffuse tension. Simplify communication. Use short, clear sentences. Give one instruction at a time. Avoid arguing or correcting. Validation works better than logic. These strategies not only reduce agitation but also preserve the person's sense of autonomy and dignity. When medication may be considered, the article is clear. Medications are not first line and should be used only when agitation is severe, persistent, or dangerous. Non-drug strategies have been exhausted. Folks, you have to use the non-drug strategies first. Okay, a clinician can monitor side effects. Okay. This caution is important because many medications used for aggression carry risk, especially in older adults with dementia. Medicating those folks, you have a problem with balance, coordination, falls, injuries, things of that nature. So use them as last resort, folks. Practical caregiver strategies. These are small everyday adjustments that make a big difference. Plan ahead. Track patterns, time of day, triggers, early warning signs. Intervene early. Agitation is easier to redirect than when it's just beginning. Reduce caregiver pressure. Offer choices. Would you like to wear the blue shirt or green one? Folks, let them pick their clothes if they can. It gives them uh, a sense of pride because they pick their own clothes. It gives them a sense of um, control again. So, let them pick their own clothes. Break tasks into smaller steps. Allow extra time so neither of you feel rushed. Protect your own well-being. Agitation is exhausting. Caregiver burnout is real. Use respite care. Ask for help and build a support network. Remember, a calm caregiver helps create a calm environment. When to seek medical help. The article notes that sudden or severe agitation may signal a medical issue such as infection, medication reaction, pain, delirium. If agitation escalates quickly, threatens safety, or comes with fever or confusion, a medical evaluation is essential. One-page printable checklist, a training slide, or a family-friendly handout that blends science, compassion, and practical steps. Explanation of the page section, anxiety and aggression, comes from the Alzheimer's Association, folks. Second part of the show. Okay. Alzheimer's disease. Why they occur and practical steps caregivers and clinicians can take to prevent and respond to them. It treats agitation as a symptom rooted in the disease and in treatable triggers rather than as willful misbehavior. What causes anxiety and agitation? Biological basis. The page emphasizes that agitation is a direct result of dementia-related brain changes that reduce the person's ability to process new information. So what happens, folks, when that starts to happen? What happens for them is like a movie in their brain, but it's the flashbacks. It's the triggers are mostly flashbacks from people abusing them, uh, you know, being angry with them. It comes out as aggression towards folks in some forms of dementia. Okay. Let's see. Next page. Okay, information and manage stress. Common triggers: changes in environment or routine, moving to a new residence, hospitalization, unfamiliar caregivers or guests, sensory overload, noise, glare, background distraction, fatigue, pain, infections, medication side effects, and misperceived threats can all precipitate aggression. Tips to prevent agitation. Practical non-pharmacological strategies. Create a calm environment. Reduce noise and visual clutter. Limit background TV and remove obvious stressors. Monitor comfort and basic needs. Check for pain, hunger, thirst, constipation, full bladder, infections, skin irritation, and room temperature. Keep routines simple and predictable. Consistent daily schedules and simplified tasks reduce confusion and frustration. Offer soothing rituals and activity outlets. Gentle exercise, walks, music, gardening, or familiar objects can redirect energy and lower anxiety. How to respond when aggression occurs. Do these things: back off and ask permission. Use calm, positive statements. Reassure the person. Slow your pace. Offer guided choices. Focus on pleasant topics and limit stimulation. Okay, guys, I'm going to give you some things to say when that happens. What to say: short, reassuring phrases such as "You're safe here," "I'm sorry you're upset," and "I will stay with you until you feel better." Help ground the person. What to avoid: do not raise your voice, corner or crowd them, restrain them, criticize them, ignore or argue, or make sudden movements that could increase fear or confusion. Medications and medical evaluation. Medical checkup first. The page advises a thorough medical evaluation. Whenever behavioral symptoms appear, suddenly to rule out infections, pain, medication reactions, or delirium. Medication caution. Medications are not first line defenses, folks. The page notes that brexpiprazole, Rexulti is FDA approved for aggression in Alzheimer's disease, but also highlights the FDA safety warning that atypically antipsychotics carry an increased risk of death in older adults with dementia-related psychosis. Medication discussions should follow careful diagnosis and clinician oversight. Folks, medication for dementia aggression is last defense. It's always last defense. You never want to medicate somebody just for the hell of it. You want to find a safer way first. If the first one doesn't work, then medication is the last resort for folks. Practical caregiver guidance and support. Track patterns, note times of day, triggers, and early warning signs so you can intervene earlier. Share experiences. The page encourages caregivers to connect with support communities, to exchange strategies that have worked, prioritize safety and dignity. Intervention should aim to reduce distress while preserving the person's autonomy and comfort. Okay, that is tonight's B for you. I'll be back on tomorrow for shows, people. See you tomorrow. Have a good night, folks.